Some unsuitable cases are more of a comprehensive case, just severe crowding, cases that require a little bit more work and time. That case took about 18 to 24 months. This case is still currently in refinement. Another unsuitable case is anterior open bite. This case took about 12 to 18 months, and this case is in refinement to still level out their lower anteriors. Another unsuitable case is extreme open bite with class 3. This patient was referred to the orthodontist and oral surgeon for possible orthognathic surgery. Setting patient expectations. This is probably a very big factor when we do our Social 6 cases. Social 6 will straighten visible teeth, improve aesthetics quickly, and require retention afterwards, which means aligners for life when patients are finished. Social 6 won't correct bite issues or perform major movement or expansion. So let's go over the key takeaway. We're focusing on straightening the front teeth. We're not doing a bite correction or jaw changes. That's why we can complete treatment faster and at a lower cost. Think of it like a precision-tuned, not a full remodel. So the Social 6 workflow: initial consultation, examination, treatment expectations, and then fee structure. Typically, we're proposing aligners during routine dental appointments or sometimes no patient exams. We conduct a thorough exam and review their scan, and then we go over setting realistic expectations. Once patients accept, then we discuss a fee structure and payment options.